Welcome back to our special Heartland USA edition of Home and Lifestyle TV. We are here on the beautiful patio of Dr. Hatchett's Urology Institute and Hatchett Rejuvenation. But let's talk about the star of the show, Maximus. Look at this good-looking guy.
My little 11-month-old boy, I love him to death. He's wonderful.
So you have two practices in one.
Yes, I do. I realized that so many urologic problems were because of metabolic problems. I said, wait, there's so many associations with obesity, with hormone problems that are causing urologic problems. So that's what started my journey, and I went on from there, and I just kept adding to it.
So let's talk about urological issues, men and women, but primarily men, correct? The BPH. Can you explain that to us?
After about the age of 40, men start suffering from enlargement of their prostate. Medications start coming out to treat enlarged prostate. There's a few that we use, one to relax the prostate, one to shrink the prostate. But so many of these men were left on medications for so many years and they weren't getting proper treatment of the prostate. So that's where I started this subspecialty of minimally invasive treatments for BPH.
So that's the UroLift and Resume therapy.
Both of them, first of all, are 10-minute office procedures.
Really?
It's so much easier to tell a man, I can fix this problem for you in a 10-minute procedure versus I have to put you under surgery.
Hospital, higher medical bill, etc.
And the anxiety of it.
Yeah.
I was getting up every hour to go to the bathroom. And when you're doing that, you're not sleeping. And I fought that and fought that and fought that and said, no, we've got to try something different.
The other, called Resume, is called water steam vaporization. It's a 9-second treatment.
I can imagine this is a touchy subject and men may feel shame around the subject, talking about it. What would you say to those men that are having these issues, but they're just, I don't know, just too fearful to come in and actually get something done about it?
It's actually not something they're ashamed of. It's just that they have not been given the proper information.
Yes.
And they just assume my doctor refilled my prescription. I'll just stand this pill. So I guess that's the only treatment.
Like the only option.
The only option. And I would say of the men I talk to, over 90% of them agree to have the in-office minimally invasive procedure.
It's just like you've turned the clock back probably 10 years on me, you know, to where I could get back to where I could use the bathroom like I used to could.
If you're tired of just being on medications, if you think that your symptoms are getting worse, if you're getting up 2, 3, 4, sometimes 6 times per night, you should call a urologist that specializes, like myself, in minimally invasive treatment options. Because there's an answer out there for you, and medications may not be the answer you're looking for. So I urge all of you, look further. Don't live your life with a catheter. Don't be stuck with a catheter at the end of your life. Call a urologist that specializes in what I perform, which is UroLift and Resume vaporization.
Sounds like you're giving them their life back and their livelihood. On top of the sexual dysfunction that they may experience, just the lack of freedom that they may feel from having a catheter. I would assume that you just would give them so much more freedom in their life to be active.
Men and women who have bladder problems have to sometimes decide on their trip to sort of plan their trip based on bathrooms.
Yeah.
Is that, I know this place has a clean bathroom. We'll stop at this place.
Yes.
We'll stop at that place. I have to urinate every 2 hours. I didn't get much sleep last night. I'm tired. I got up 6 times. So we hear these stories, and so we have options for these patients.